So thank you so much for joining us today. It's so nice to see so many of you. So just to give a quick overview of what we'll be covering. So we're going to be looking at the sort of three types of searches, how to answer a clearly formulated question, how to translate your question into a search, different search frameworks to help you with that, and where to search, and lastly, search techniques and tips. And just to sort of say that this is sort of intended to be quite an overview of searching, because I'm aware that it's you're quite a disparate group, and you might have access to different resources. So we're not going to be covering any one specific database or resource in detail. It's intended to give you sort of a more broader overview. So how do we typically find information? So I just wanted to start off to ask you to take a moment to reflect on how you typically find and look up information. So, we live in what's often described as, say, like a digital information age, and searching for information on our smart devices, has become so ubiquitous. We do it so frequently throughout the day to inform our decision making, from, say, looking up directions on maps, reviews of what to buy or where to go, so much so that we very much take it for granted. And searching for information can be done, just a few taps on our devices, or we're even at the stage now where we can ask our devices to look up things for us. So you might be thinking, I know I certainly did before I started working in this field, is, I look up information all the time. Why would a session on this be useful? And the simple answer is that, there's a lot more to it than, if you're looking up sort of information for a specific topic, for, say, to guide research. Than simply looking up information on the fly. And anyone who's had a stab at researching a topic and ended up with what feels like hundreds of tabs open, notes strewn all over the place, and thinking, how did I get here? Then this session is for you. And what we sort of want to cover is how we purposefully and objectively search for information on a given topic, rather than passively browsing or feeling like you don't know how to get started, or getting sidetracked and feeling overwhelmed. So searching within a framework and with intention, as it were. So full disclosure, I recently saw a really excellent presentation by an information specialist colleague based at the University of Sheffield, called Mark Klaus, on searching for qualitative information. And he referenced this paper and diagram. And so this is the search triangle, and it's taken from a really interesting paper by Gussenbauer and Hadaway called What Every Researcher Should Know About Searching. And they argue that in order to achieve more effective and efficient searching, one first needs to understand what it is that you, the searcher, wants to achieve. So what goals do you have in mind? What am I trying to find out? And having an increased knowledge and awareness of how and why we search, and the benefits and limitations of the systems in which we search for information, greatly improves not only our ability to search, but also leads to an increased awareness of what we find and what we don't find, and the conclusions that we draw. So the goals that you have in mind and your topic of interest will dictate what methods, or heuristics as they call it, you'll employ, such as like where to search, what are the most appropriate resources that will contain the most appropriate types of information to answer your particular question. And the three types of search that they identified are these three. So it's the lookup, the exploratory, and the systematic. So the lookup search, this is the type that we most commonly employ throughout our day-to-day lives, and the one you're probably most familiar with. It could just be looking up something like, say, a specific set of reports, or verifying something that you've heard or need to look up. So like a policy, for example, like when was Every Child Matters introduced, for example. So it's very targeted with a specific goal in mind. And the paper by Gussenbauer and Hadaway point out that it's important to be aware of the limitations of each type of search. So with this type, due to its quick and targeted nature, bias can present. So you could be doing what we call cherry picking. And this means that you're only looking for and utilising information that you want to find. So it could confirm an argument or belief on a given subject. And there could be evidence out there that counteracts this evidence, this point of view, but you're not going to find it because you're not specifically looking for it. So it's something to be aware of. And it can sometimes be unintentional and happen unconsciously. But, it is useful to be aware of, even if it's something that's difficult to avoid because you don't necessarily have time to carry out a more extensive search. So it's a case of being aware of the constraints within your working with. The second type is exploratory, and this can be a topic or an area that you want to explore in further depth. It could be something that you may be wanting to carry out some research on, or you say if you're wanting to put in a bid to receive funding, or something you've been asked to write about, say if you're studying or proposing something at work. And very often this stage can feel quite fuzzy, and searching for it and reading around the subject can help you gain further understanding, and it can also help you to define your question. And this type of search also comes into the third type, systematic. So it's an initial stage when doing a systematic search. And it could be seen as like a luxury, say if you don't have a lot of time to do your systematic search, and you might be really keen to just jump straight into doing systematic searching. But as we'll go through the steps of doing a more kind of systematic search, and hopefully what you'll learn is like this exploratory search is vital. And I know that I, for one, have learned the hard way of having to go back to the drawing board. So say if you just go straight into doing a systematic self-search and then you don't do that initial sort of scoping, you could get results that you don't necessarily expect. So you might need to sort of go back to the drawing board. And thirdly, also you might do what's known as a negative search. So this could be something that you might want to identify. So you could identify that there's not much research published on a certain area. And so say you find that there's no research on the topic that you're interested in, or the information that you do find is very, very out of date. You could then plug that gap by carrying out research in a particular area. And lastly, systematic searches. So these are the types of searches that myself and my colleagues are regularly involved with. And this is the process of systematically searching for a topic. So this is searching for a clearly defined question using transparent and reproducible methods. So we clearly set out where and how we'll search for a topic, and the methods are quite often reported as part of the published review. And so it's to ensure that people reading it can reproduce what we've done, and then we're not cherry picking information. So the information has been retrieved using unbiased methods. The types of review that we sort of systematically search for. I don't have time to go into each one of these in detail, and it's not that useful for the focus of this presentation, but just to point out that there's no one size fits all. And Sutton et al. Identified 48 distinct types of reviews in their study, meeting the review family. So the type of searching that we would do would depend on what kind of review it was. So say if we were looking for qualitative evidence, for example, we would look specifically for qualitative evidence, or if it was a rapid review, the search would be sort of more pragmatic in style, and we might search a more discrete number of databases, but we would make sure that we would report that. Or we might be carrying out what we sort of call a traditional systematic review, where the aim is to identify all published and unpublished research on a given topic. So we deal with each review on a sort of case-by-case basis. So I was just going to go through the sort of stages that we do when carrying out a more kind of systematic search. And the scoping exploratory search, so we've sort of touched on this already, but just to really highlight that this stage is crucial. So what we would do is we would do an initial search at the start of a project, and we would have a look to see, to sort of scoping what is the information landscape like out there like. So it gives us an estimate of the size of the literature, how much is out there, what types of studies are coming back, where are studies published, so is there a particular area where there's a lot of research, and this can help us to sort of get a sense of what might be the most appropriate sources to search. So we could select specific databases or organisations to search that would be rich in that kind of information. And these last two points are really crucial. So has the review been done before, and is someone else currently doing the review? So we would have a look to see if there are any recently published reviews, and see if somebody already answered this question, or is someone currently doing the review. So Prospero is a register where review authors publish the details, so the protocols, so like their plan of action of their systematic reviews. And it hasn't been published yet. So, but say if we have a look and see that there's a review in process, then it would be worth revising the question, because if someone else has already done the review or is doing it, then it would be unlikely that our review would be published or funded. So pardon me, we would need to then revise our question if someone else has already recently done or is carrying out your question. So answering a clearly defined question. So a clearly defined question helps to minimise bias. So by reducing the possibility of ambiguity. So a loosely defined question will result in vague conclusions. So it's important to have your question sort of as clear as possible. Because, like I say, if it's loosely defined, then you're less likely to have clearly defined conclusions. And there are frameworks in which to help you with this, and also with your search terms. The most commonly known one is the PICO framework, and this stands for patient, population, phenomenon of interest, intervention, comparator, or outcome. So your P effectively is your who. Who are you interested in? So what are the characteristics of the people? Do they have a specific condition? Are those particular sort of age range or sort of demographic? It could be a particular occupational group, or say like care home workers, occupational therapists, or they're based in a particular setting. So, for example, care home residents. It's really thinking about who does this impact. The intervention is the what. So, what is being looked at? So we sort of do a lot of research on, say, drugs or an intervention. But it could be an exposure, so people who've been exposed to certain things, such as, say, like smoking. So it's sort of what is it being done to these people effectively. Comparison. This is if your question is looking at one thing compared to another. So if your question explicitly states that it's worth having both things in your search. And lastly, the outcome. So is there a specific outcome of interest that you're interested in? So for examples could be sort of, say, improved quality of life, sort of cost-related outcomes, any sort of outcome that you're particularly interested in. Again, it's important to point out that there's no one-size-fits-all, and the PICO framework was sort of pretty much developed for sort of health clinical reviews, so it might not be appropriate for your particular topic. There are other frameworks that have been developed for different study areas, such as social care or health management. It's important to point out that you don't need to get too bogged down with these, and you don't need to fulfill every element if you do use one. So, for example, we very often use the researches that me and my colleagues do quite often fall into the PICO framework, but it would be very unlikely that we would fulfill every element. The ones that we tend to miss out the most are comparator or outcome. Say if the question doesn't include that, because particularly for outcome, if we search for a particular outcome, say if we were doing a study about the effects of an intervention, we then might miss other outcomes of interest. So it might lead to sort of improved quality of life, but there might be other outcomes that we don't find if we specifically search for that. So it's just being aware, and really what these frameworks are to help you, it's more kind of prompts to help you pull out the most concrete aspect of your question of which to search for. So you wouldn't search for, say, terms such as what is there, for example. It's what's the most concrete aspects of your question that you would search for, and it might just be one thing that you would search for. And it might also be useful to restrict your searches to a particular study type if that best matches your question, or it will be the most the best quality evidence to answer your question. So say if your research that you're interested in is about the views and experiences of a particular group of people, then qualitative research would be the best research type to answer that kind of question. Or say if you were looking at the effectiveness of an intervention, then randomised controlled trials are considered the gold standard. And if there were published randomised controlled trials out there, then you could potentially limit your study to randomised controlled trials. But as I say, it's searching can be a very iterative process, and once that exploratory search will show you what kind of results you're getting that will inform these decisions as you go. When you start to build your search and start to think of your search terms, so when you search for a question to guide your research, you very often, how you search is quite different to, say, typing in like a question into a search engine such as Google. it's useful to sort of think of a range of different search terms of which to use. And how we do this are sort of methods known as berry picking and pearl growing. And what this really is if you find some relevant papers, have a look at those. So have a look at the titles and abstracts and closely examine them. And the searching is always about like the language that's used. So have a look at the language that's used to describe the concepts that you're interested in. So the things to be aware of are different spelling variations. So it's all about how the different authors use language to describe the things that you're interested in, and different authors will use different terminology. So things to be aware of are, say, for example, spelling variations, such as, say, like American spellings, such as, say, colour or colour without the U, or randomised with an S or a Z. So synonyms is what that means. So it's different terminology to describe the same thing. Sometimes acronyms are used, and it's important to use that in your search so you don't potentially miss studies where some authors might have used acronyms or abbreviations. Old and new terminology, so language can change over time. So, for example, I remember doing a search for domestic violence and looking at the old terminology that was used. Some of the terms were quite shocking and really surprising that language was being used in older studies. But yet it was worth including that in the search to make sure we didn't miss useful older studies. So it's important to think about how language changes over time. If you're looking at, say, sort of medical interventions, sometimes drug terms can have brand names as well as sort of pharmaceutical medical names. So it's important to use that in your search terms. And limits. So sometimes databases allow you to restrict by date or by language, and it can be valid to do this, but sometimes it's worth pointing this out in your method section if you were writing a review. So say if there was like an act of policy that came out in a certain year and practice in your field changed at that time, then you can restrict your search for a certain time. But if you're writing a review, it's worth pointing out in your methods that that's why you've done that. So if you were starting to draft your search, so say, for example, I'm interested in, if I want to know if music therapy is beneficial to nursing home residents, I could think about this PICO framework in which to think about my search terms. And it really is just a case of sort of jotting down your terms as you go. So I've started to think about synonyms in relation to my PICO. And for this one, I'm not going to search for comparators or outcomes because it's not explicitly stated in my question. So nursing home residents could be referred to in a variety of different ways. So it's useful to incorporate that into my search. And the same for music therapy. So it could be referred to as, say, therapeutic or singing groups or choirs. And say if I was wanting to restrict it by study design as well, I could do that. Oops, sorry. So Boolean operators. So we use this when we're searching databases, and this is how we combine our concepts. So say, for example, I've got my concepts here for nursing home residents, and these circles represent that I'm using my synonyms and I'm combining them using all. So I've got sort of say nursing home or care home or long-term care, and I would combine those using all. So that's my first concept. My second concept would be music therapy. So I'll start to develop my terms and I would combine each concept using and. So on this right-hand side here in this diagram, I'm interested where those two circles meet. So those studies just in studies about care home residents or just about music therapy. I'm interested in both of those things. And so where to search? So ideally, if you're doing a review, you'd want to search a range of different databases. Say a search of just one, say Google or PubMed, for example, wouldn't be sufficient. You want to try and search a range of different databases because unfortunately there's no one-stop shop. Things are indexed and put onto different databases. So you'd want to to ensure that you're doing a comprehensive and thorough search. You'd want to search a range of different sources. So in selecting which ones, you want to think about which are the most useful sources and resources. So for example, for my subject, about nursing home residents. This might sound obvious, but say like a search of something like that's about children, like the NSPCC, for example, wouldn't be an appropriate place to search. So it's thinking about the most appropriate and most useful source for your particular question. And again, yeah, thinking about the different types of information that's available to you. So as I said, you know, I'm aware that some of you will have different access. So some of you might be fortunate to have access to the NHS library, or, you know, thinking about you might want to use, say, government reports or industry specific guidelines, for example. And thinking about what's the most sort of important and appropriate, and also what's available to you type of research to answer your question. And so, yes, this is again a plug. So if you do have access to an NHS librarian, do use it, because that's what they're for, and they're really amazing guides, you know, sources of information, and they could either do your search for you or with you, and they would be able to show you what the most appropriate databases to employ for your search. So yeah, those of you who are lucky enough to have access to this, do make use of it. I was just going to talk a little bit about Google and Google Scholar, because they're really commonly used, and for good reason. They're really sort of quick and easy to use, but it doesn't, you know, it does. There are limitations with it as well. So just important to be aware that, you know, they are quite ambiguous in terms of like how they rank their information. So it can be quite hard to reproduce Google and Google Scholar searches, which is not great for us doing systematic searches, but it is worth using. And I just got here a slide on some tips on how to search Google, because it can be, you know, there can be things you can do to sort of improve your Google searches. If you type into Google Advanced Search, it'll bring you this browser, and it gives you more control over your search, and you could do certain additional things. So if you wanted your search to have this exact phrase, so something that's quite loosely defined, like quality of life. So ordinarily, if you search for that term on its own, it will search for those words, but in which it appears anywhere in the text. So if you search it in this box here where it says this exact word or phrase, it will search for it as it appears exactly. This one here where it says a site or domain, this is really handy. So if you're wanting to find information from a certain resource, say, for example, the CQC or the NHS, if you put which organisation it is you're interested in into this box, it will only bring back results where it appears in the URL. So it's a really good way of finding information on a topic rather than having to trawl through an organisation's website. And lastly, the file type. So if you select PDF, you're more likely to generate some reports in your searching. So that's a useful thing to employ when searching Google if you're looking for reports from an organisation. And it's just some sort of advice on sort of where to search. There's different sorts of study areas. The ones that have an asterisk are the ones that are not freely available, unfortunately. But if you do have access to an NHS library, you will be able to access them. So Medline and Embase are big healthcare databases. The Cochrane Library and PubMed are freely available. Cochrane Library is an excellent source of systematic reviews in healthcare. And CINAHL, Embase and British Nursing Index and Nursing and specific databases. And there's some psychology and mental health and social care databases. But again, sadly, these are not all freely available. And health management and information consulting and allied medicine, which is AMED. Freely available resources, and also what we call grey literature. Now, grey literature is quite a catch-all term that we use, and it just means information that isn't commercially published. So it's not to say it's any lesser quality, but again, unfortunately, there's no one-stop shop resource for finding this information. So quite often you have to go directly to the source, such as, say, the King's Fund or Social Care Institute for Excellence and search it manually. But there's loads of really good sort of research organisations like this that's worth sort of having a look for. But as I say, unfortunately, there's no one repository that sort of houses all this sort of information. And the one that you would use is the one that would like to be most specific to your particular question. So say if you're interested in sort of economic, social inequalities, Joseph Rowntree Foundation is a really good resource. And the Campbell collaboration is almost like the sister organisation of the Cochrane Library in that they produce systematic reviews, really high quality, but more kind of social care sort of perspective on those sorts of topics. But how you find these sorts of resources you'll sort of notice those when you're doing your exploratory searching at the beginning. So it's worth sort of keeping a note of those. So as I say, it's not always an iterative process. You might sort of discover organisations as you're going along. Supplementary searches. So this is another means of searching. So rather than just searching resources or databases, there's other methods that you can employ. So you could look for unpublished research, such as say trials registries. So this is repositories of clinical trials that are going on, and sometimes there are clinical trials that that get abandoned, so that don't go to publication. So it's worth having, if you're doing research on a drug, it's worth having a look at clinicaltrials.gov. And searching forwards and backwards searching. So backwards searching is having a look at the references. So if you have a piece of research that's really relevant, that's really useful, having a look at their list of references at the back of the study, because you might find key information there. And this again is a valid way of searching. So as much so as searching a database. So if you do this, make a note of it and put that you've done it in your methods. And forward citation searching is looking to in the future to see any subsequent studies come out that have cited the reference that you were looking at. So say, for example, you can do this on Google Scholar. So this picture I have here, I've just typed in an article into Google Scholar, and it'll show you underneath cited by, shows you which studies have then been published that have cited that particular article. So that can be a really good way of finding additional information rather than carrying out searches. And it's likely to be related to your topic if it's citing that key piece of information. You can contact authors directly to ask them if they're aware of any research, and they could have some research that they're working on that's not yet published or never been published. That's a really good way of getting information. Having a look at industry websites, for example, and sort of carrying out targeted searches. And on some databases, such as say PubMed, they might have a section. If you search for an article, they have a section at the bottom that says related articles. So if you do that, again, it's just make a note of it. That's something else that you've searched. But it can be really good and a good way of finding key information. AI. So this is a bit of an elephant in the room. Some of you might be thinking, is there tools that can do all this for me? And there is quite a lot of AI technology out there at the moment. I'm definitely by no means an expert in it, but me and my colleagues are sort of keeping a cautious eye on it. Some tools connect papers based on sort of keywords, and they can be quite useful, such as Sci.ai, and Elicit allows you to sort of put in like a question and it will suggest papers for you. They are very good, and I think they're well worth sort of using, and they can be quite reliable, but I still I don't think they are an alternative to traditional database or even Google Scholar searches yet, but they're a nice additional instrument. But it's quite early days. Some AI offer like a chatbot interface, such as say ChatGPT, such as a traditional search sort of interface, and you get your answers in more kind of a natural language. But what I would say doesn't necessarily mean the results are better in terms of scope and relevance. So I don't know. I think the jury's still out, but it's well worth sort of keeping an eye on. But it can be used as sort of an additional method. Some other sort of search tips. So if you have sort of, for some sort of terms, if you're searching for a phrase, so for example, say quality of life, which I already mentioned, or outdoor swimming, this works on databases and also sort of search engines as well. If you put your terms into quote marks, it will search for your term as a phrase. So as I said, for quality of life, it can be really helpful because otherwise it searches for those terms anywhere in which they appear in the article, which cannot be very helpful. So this is a quick way and you know, a good way of making your search a bit more targeted. Database indexing terms. So if you do search a database, some databases such as PubMed allow you to search using indexing terms. And it's useful to sort of be aware of to make sure that your search is exhaustive. If you do have access to an NHS library, it's worth asking if you a librarian about this. But the database, some databases have an index that sits behind it, and the articles that are put onto that database are given sort of indexing terms. And that's another way that you can search for information on there. So you could search for information using the free text, so searching for in the title or the abstracts, or you could also search for what's known as the index. And as I said, PubMed has this, and it's known as mesh. But it's a useful thing to be aware of if you are searching databases such as PubMed. So what can I do? So if you're doing a search and you find that you're thinking you're getting too many search results, and you know what should I do? This is something that I used to get asked about quite a lot when I was a librarian. So if you're doing a systematic review, this can be quite common. I know that reviewers will be that I work with will be used to getting large sets of results. If it's too much for you within the constraints of your work, you could then think about maybe restricting it. So restricting it by, say, study type or particular aspect of your review. You could try looking at your search terms and seeing if you could sort of focus them in any way. So if there's phrases that you're searching for, could you put them in quote marks? Just sort of revising your search in a certain way to see if you can make it a bit narrower. And the opposite end of the scale, what do I do if my results are too small, if I don't feel like I'm finding enough? So you could start to broaden out your question maybe. So think about, have you considered all the potential synonyms or terms, search terms that are appropriate? Perhaps there just isn't that much published in your area. So by primary research, what we mean is, you could go out and do your own unique research. So going out and, say, interviewing people, like qualitative research. So, or, you could make research recommendations to say that more research is needed in this area. But yes, this is something again that we come up with in our work. But yeah, I think the main thing would be to think about, have I considered all appropriate search terms, or would I need to revise my question to make it broader? Keeping a log of your search as you go is really important. So just to keep a note of what you've done and why you've done it. And if you are doing like a review that's going to be published, it's worth keeping a note of all this because you might need to report it in your methods section. This diagram on the right-hand side is something that we quite often do when doing systematic reviews. So we need to keep a record of how many results that we found and what were selected and what weren't. And this is done to sort of maximise transparency, so readers can see what it is we've done, and then that we're not arbitrarily just sort of cherry picking articles or dismissing them. It's keeping a record of what we've done throughout. So in short, your search should be it's effectively a trade-off. So how long you spend on your searching might impact how long you've got to go through your results. So it's weighing it up how long you have. So it's ensuring that your search is broad enough that you hopefully have searched a broad range of resources, that you've included a broad range of terms, but at the expense that you've not gone so far, that you've searched so broadly that you don't have enough time within your project to go through the results. So it's finding that fine balance really. Or if your search is too targeted, if it's too specific, that you don't potentially miss things. This is what this sort of slide about sensitivity and specificity really means. It's ensuring that your search is sort of broad enough and not too specific, but at the expense that it's not too much so. So it's about finding that drawing that balance really. It's something that me and my colleagues are always sort of weighing up when doing searches. Saving your search results. So there's software out there to help you. So Zotero and Mendeley are free reference management software. I don't have time to go into these in detail, but these can help you save your results. So if you do a search, and you can save your results onto one of these into what we call a library, and it will save you having to rerun your searches each time. So it's one central place to keep all of your search results as you go. And you can do different things like creating groups and stuff to organise your results in a way that makes sense to you. So they're very handy. Apologies, I've got to emphasise the double A here, so I'm not swearing at you. But just a quick sort of acronym to help you. So when, say, for example, if you're doing like a targeted search as well, how do I trust the results in which I get? And something that I remember from when I was at university is, does it pass the CRARP test? So thinking about when it was published, how relevant the piece of information was, who wrote it, what are their credentials? Can I trust what they say? How accurate it is to what it is you're looking for, and what was the purpose? Why was it written? And so, sort of overall, the sort of search process. So it's, as I say, it's quite an iterative thing, but it's sort of planning as you go, keeping a note of your sort of methods as you go, and your plan of action. And if you need to change your methods, sort of recording that as you go as well. Testing your searches and sort of exploring to begin with, using a broad range of different terms and different methods, and then recording. So recording your methods, and also you can save your results using sort of reference management software, or however that makes sense to you. And so lastly, just the things to be aware of when doing your searches. So your search might not be a linear process. It's important to employ lateral thinking, so be prepared to try a number of techniques and approaches. And the approach that you take will depend on your question and how much is written on it and what you have access to. And if you do have a librarian, do utilise it. And these are just different resources that I've made, that I've drawn upon for you to check out. I'm going to stop sharing, and I'm aware that I've gone way over time.
No, we've got 5 minutes left. Thank you very much for the informative session. That was very useful. I learned a lot. Please, if you have any questions, do raise your hand. The meeting chat isn't working, so please raise your hand if you have any question, and I'll just bring you up. So is there anyone with a question? No questions yet. In the meantime, I wanted to ask, like, what the time commitment is. Like, how long do you think it, or in your experience, how long is it really take to find?
A really good question, and unfortunately, there's no sort of definitive answer. It sort of depends on the project and how long there is for the project. But I think sometimes people think it's a really sort of quick process, and it really isn't. It does require a lot of planning, a lot of back and forth. So we work primarily we're very fortunate that we can work in a team, and so we'll work with a lead researcher, and so there'll be a lot of backing and forthing, sort of working things out. So if you were doing it sort of on your own, but I would say it's not necessarily like a couple of days, it can be a couple of weeks. but like it's how long's a piece of string, and it's how long you really have to do the project. But it's I would say sort of it's not iterative, so you might find that as you're going along you might need to revise your search, so it could be like an ongoing thing, but yeah, the short answer would say I would factor in a number of weeks, but you don't want to be at the same time at the expense if you spend too long perfecting it, you don't want to end up with not enough time to go through your results. So yeah, it's try and factor in ample time and be aware that you might need to change your approach as well as you go, and you're learning as you go.
Okay, thank you very much. We've got a question from Sarah. Yeah, Sarah, you can unmute yourself now.
Hi there, thank you for the presentation. I'm from another HDRC in Leicestershire, so I'm coming from a local authority perspective. And I suppose my question is, I know you talked about the limitations of Google and Google Scholar, but if we don't have access to those kind of academic databases, is that our best way to go about literature searching and go about evidence synthesis, or are there other databases you would recommend that don't have kind of costs, or how would you support local authority trying to do literature work?
Yeah, I would say Google and Google Scholar are really excellent because they're multidisciplinary, but then you might run into sort of journal articles that you don't have access to. There are sort of resources like sort of systematic review, resources such as the Cochrane Library, which is healthcare, or the Campbell collaboration. So I would have a look. It's also worth having a look at university institutions as well. So they publish a lot of open access. So there might be a specific institution or department that specialises in a certain area, and quite often if it's a specific condition, there might be sort of a charity or sort of like a research organisation that produces good quality research in a certain area. So yeah, it depends on the topic, but it's unfortunately sometimes it just means doing a bit more sort of manual, like looking for organisations. But it is out there quite often, but it's just a case of sort of having to spend a bit longer trying to find it. Yeah. And very often if you do find a report that's like a journal article that you don't have access to, sometimes this is being recorded, to be careful, but if you contact the author, they might be able to send you stuff as well. I found that to be a useful sort of way of getting information in the past. So.
Yeah, okay. Thank you very much. Thank you.
Thank you very much for that. Well, that's interesting. I didn't know you could, just reach out and send it. Okay, thank you. Yeah. Does any other person have any questions? No. Okay. Well, we've come to the end of the time of the meeting. So thank you everyone for joining this meeting today and for taking time out of your days to, join us and listen to Naila talk. Thank you again, Naila. Looking forward to seeing you another time. Yes. Take care. Bye bye, everyone.
Okay. Yeah. Thanks so much, everyone.
Bye-bye.
Thank you.
Yeah.
Bye.